Statistics from the Massachusetts Department of Public Health show that the number of confirmed COVID-19 cases in the state is now over 75,000, with nearly 4,710 deaths. Aziza Shirazi is a frontline health worker at a medical facility in Boston, Massachusetts.
I have been doing this for close to 2 years now, and despite the circumstances, I still enjoy going to work and I love what I do.
Shirazi, who works 36 hours per week inclusive of night shifts, says she's not scared.
My routine is pretty much very simple. I work 36 hours in a week and I mainly do the overnight shift, which is also known as the graveyard shift.
She speaks about her experience with the COVID-19 pandemic.
I commute to and from work, and that means that I use the bus and the train. And what happens is, on the day where I do have to work, I sleep a few hours before I head for my shift, and I wake up 1 hour earlier. However, when work starts, we do take the extra precautions, which I believe that everyone knows about. For example, like the hand washing, and we do don the PPE gowns. We also use masks.
By the end of Friday, reports show that 150 people had succumbed to COVID-19 in Massachusetts.
What scares me most about the COVID-19 is just not knowing when it's going to end. Are we really going to be able to get a vaccine? Are we going to really be able to get a cure for it? The questions I ask myself is, when is all this going to end? When are we going to go back to our normal lives?
Apart from having a family in the US, Aziza has relatives in Uganda who worry about her. She is proud of the fact that Uganda is taking positive steps to fight the spread of COVID-19.
I do think about them on a daily basis, but thank God for technology. We're able to communicate and talk each and every single day. I do, however, feel more at peace knowing that the Ugandan government has done a great job in trying to make sure that the spread of the virus is not bigger.
Shirazi says nursing has always been her passion, and even after the pandemic is over, she is ready to continue working as hard as she is now. Her parting shot: that COVID-19 is real and people should take the necessary precautions to avoid catching and spreading it.
I really feel that we have a lot more to learn about this virus, and it will only take a team effort to bring this to an end, and hopefully that will be soon.
For people like Shirazi, this kind of job does not just take one to have a passion for it, but it also requires one to have a calling to execute the duties just the way it is supposed to be to satisfy many people. Maurice Ochol, NTV, here in Los Angeles, California.